Dr. Kourakin, you explained very well how missing teeth, kind of are a problem, and showed us patients who kind of sometimes don't believe in it that it is, from chewing and digesting and having problem 10, 20, 30 years down the road, from major headaches you can get, and even gum disease, because when the teeth are crooked, then the food rests can get in there much easier, more difficult to get out because they're closer together or far apart. Either way, it's more difficult to floss and brush, and thus gum disease in itself. So there's a tremendous amount of things besides of eventually looking bad, because it will move into the front and distort the whole mouth. So what are some of our major options currently to replace such a missing tooth? And just shade a little bit of a picture, not very detailed, of what are some of those major options, pros and cons, and how they are used.
Well, everyone should consider implants to replace a tooth. We do implants in our office. It is the most natural tooth replacement because it simply involves placing a implant into the jawbone and a crown on top of that, and that functions as an individual tooth in the same way that nature or God had created a tooth to function. It flosses the same way, it chews, it bites, and it feels the same way.
And an implant is basically a kind of a metal stick, a metal screw, which is made out of titanium, the way they make the hip replacement metal, and has a very good record of integrating with the body. Is that correct?
That is correct. It's a titanium oxide screw, and it does integrate, just like you said, the hips and the knee joint replacements.
Beautiful. Now, nevertheless, we have what most of us still know as the bridge, and it has done for quite some, 5, 6, 10 decades, a good job. Is it really extremely outdated, or are there still times when a bridge is actually okay and to do?
A bridge is not just okay. A bridge is the treatment of choice many times. For instance, in the upper molar region, in the back upper area here, because of the position of the sinus, quite often an implant cannot be placed without placing the sinus into the implant into the sinus. So therefore, a more reasonable choice is to simply place a bridge connecting a back tooth to a forward tooth and then closing the space in between with a crown. The bridge will feel just like a crown or a natural tooth. It will feel like an implant tooth. The only difference is the maintenance. With a permanent bridge, you need to floss in a different fashion there. We need to thread the floss around the bridge as opposed to an implant. But as I said, sometimes we're just not fortunate enough because of the sinus position. Sometimes we're not fortunate enough because there is not enough bone, because people with periodontal have waited too long, and now we do not have enough bone because, for instance, in the lower jaw, the main nerve of the jaw is too close to the surface. We do not have enough room to place the implant because for fear of striking the jaw and causing paralysis. So once again, we will look at the bridge as the second treatment of choice. And it's a wonderful treatment. I've placed bridges in both my mother and my father, and so I believe in them totally. I would not have a problem having a bridge myself, because as we all know, and as you had said earlier, it has withstood the test of time. Decades and decades, bridges have been placed in patients' mouth. There are far more crowns and bridges than implants that are surviving at this particular time.
Got it. All right. So that said, what makes a implant a better choice if it is possible? Forget the times when there was not enough bone, when it was in a position where, the sinus gets touched and all that. So let's just say, we're like somewhere here in front, or what makes then an implant a better choice? What's that reason?
An implant is a better choice for several reasons. First of all, as I said, it's very easy to maintain. It's very simple to floss because you will floss it like a natural tooth. And we've all learned how to floss teeth from the time we've been children. So you brush the implant like a natural tooth. You floss the implant like a natural tooth. Secondly, as I said, it will feel like a natural tooth. It goes into your jawbone, it goes into the gum line, and aesthetically and functionally, it will function like a natural tooth. And then what I say to many of my patients, which is the biggest, I believe, advantage to an implant, is this. Many people are extremely cavity prone. And quite honestly, many people are very lazy about brushing and flossing their teeth. Therefore, so many people are so cavity prone, and that's the truth, they're so cavity prone that, think about this, a titanium oxide screw will not decay, ever. So, they're not going to be cavity prone again. So to spend the money once to do an implant, knowing that it's not going to decay, is a very, very good alternative there. And it is the best alternative to many people, especially those that really have a problem doing their home care and their maintenance. Because
let's go to this home care and this maintenance. Let's shed a little more light on there. I mean, we know we need to brush and floss. We know that. So, when it gets more difficult and you have, because a bridge is basically 3 or 4 teeth welded together, for lack of a better terminology from my part here, and thus you cannot go in between, so you have to go underneath. And a guy like me, like when I walk with my wife into the bathroom at night, which we do since 25 some years, every day more or less together, almost every day, I floss, I shower, I brush, I shave, and she's still brushing. So you can see my detailed orientedness in that area compared to hers. So I would probably be a guy, if I have a bridge, I would quite often say, not today, tomorrow. And by doing so, I would probably develop gum disease, right? And then risk of, because of the gum disease, the bridge might fail earlier. Never mind, as you mentioned with gum disease, what other problem that causes us, from kidney to liver to heart to building up plaque to the brain to diabetes, lowered immune system, name it. So is that kind of the reason, or am I wrong there?
No, Helmut, you're 100% correct. I mean, you are John Q. Public. You're a 100% male of American dental orientation, shall we say. Most men, it seems like to me, and this may be anecdotal, but most men just don't seem to spend the time with their teeth as women do. That being said, it is very, very critical to focus on what can we do to make things simpler for you to do your maintenance there, because we want to avoid the health issues associated with periodontal disease. Because on the flip side of the coin, most men are going to be prone to heart attacks, and most men are going to be prone to be diabetic there. So, it's a double-edged sword, and we need to capture it right here in the mouth. For instance, for individuals, and this is the next generation of home care, it's a system called Perio Protect. And for individuals that either have 10 thumbs and can't floss or don't want to floss, we now make these trays, and there are these devices that will actually fit over the top, and they actually lock onto the gums. So it forms a gasket. And we place a cocktail of medication into these trays. And one is an antibiotic, and one is a type of gelatinized peroxide, and that's fitted over top of the teeth and gums. So now this fluid, this cocktail of medication, flows around the teeth and the gums, and it will get into areas where you may not be able to floss, you may not be able to get into to keep a bridge. So we're trying to do things to make people have an easier time with the maintenance of such devices here. Because
beautiful. And we're going to talk more about that, if you don't mind interrupting you. We're going to talk more about that thing here. Let's go back and just wrap up the crown and bridge thing. So let me ask you, is there evidence that a implant actually does hold longer than a crown? Because they may not have been long enough around to really know how much they outlast the other one, and maybe they have. Is there some evidence that they definitely last quite a bit longer?
I cannot say that there is evidence of that to substantiate that, simply because, Helmut, myself practicing 30 years, I have individual crowns and individual bridges that have been in place in people's mouths for 30 years, since the beginning of my practice. And I can also tell you, I have seen crowns done by my predecessor, Dr. Heron, who I mentioned earlier, with patients that are in their 80s and 90s that do still have crowns. I had one woman who recently died. She was 101, and Dr. Heron had done most of her crown and bridge when she was a school teacher in her mid-30s. So 70 years is an incredible history. It really boils down to the patient's ability to do the maintenance.
Right, and probably lots of that has to do with the doctors caring of pushing the patients to do that maintenance, just like a mom would, push us to kind of do the things we're supposed to do, and then do in itself a good work. So basically, the patients, at least in your office, shouldn't really worry too much about one or the other one, because you will tell them what in their situation is more or less is the best, and then kind of go with that. Both options seem to be good options. Most important thing is replace that gap of a tooth, because it does create all the problem. Thank you very much, Dr. Kourakin. Thank you very much.
You're very